Hello, welcome to the last and final episode of Intro to Cardiology, where we are talking about the STEMI, which is an ST segment myocardial infarct or infarction. What's going on with the STEMI is I got these coronary blood vessels here. Again, these are not necessarily anatomically correct, just so you know, but they're here just to get you the premise of them. But one of these vessels has something going on where it is not able to deliver hemoglobin-rich blood to the cardiac muscle, and that muscle becomes ischemic or without oxygen, and that causes tissue damage. So let's get into it and review a few things. We have our ECG wave here. I have my P wave, my QRS complex, and then a T wave. P wave is going to be the depolarization of the atria. QRS is going to be the depolarization of the ventricles. The repolarization of the atria is going to be lost in this large electrical complex, and the repolarization of the ventricles is your T wave. Something important to note when we are talking about STEMIs is the isometric line here. And what you're going to do to identify where that is the very beginning of your P wave, and you're going to make a line. This is the isometric line. Why is that important? A few reasons. We'll get into it, but occasionally you're going to have beats that look a little all over the place because we're bouncing around in an ambulance, and so the beginning of that P wave is your reference point. It's your legend. It's your guide to find that isometric line. So let's move on down the line here. What is the T wave? Polarization of the ventricles. We talked about that. Okay. Between the S wave and the start of the T wave is the ST segment. So I have my Q. Oh, go back. I want my laser pointer. I have my QRS and then my T. This area between there is called my ST segment. The very end of that QRS complex is called my J point. The J point is where the ST segment is measured. Bear with me here. Some of this will start to make sense as we push forward here. So just to recap here, we have what is referred to as our ST segment. That is the area at the end of the QRS and the very beginning of the T wave. And then our J point is the very end of the QRS complex, right here. J point is where ST segment is measured. All right. In a normal ECG, the ST segment line lies at the isometric line. So we're going over, again, that isometric line here, that ST segment right here, should be right in line with it, and it is. So again, in a normal ECG, ST segment lies at the isometric line. Ischemia, which we talked about before, is the lack of blood supply. And what that is going to look like is your ST segment is going to be depressed, meaning it is going to be below that isometric line. So here I have a rendition of that. We have our iso line here. And then I have the end of my QRS and the very beginning of my T wave. So this is my ST segment, and this is my J point. And you see here, it is below the isometric line. This signifies a lack of oxygen to the coronary blood vessels for one reason or another. It could be a blockage, it could be a stenosis, it could be a form of shock, it could be a number of things. Ultimately, these people need more definitive testing in the emergency department. Coronary injury. Time is muscle. Think of holding your breath. Your brain goes without oxygen, and that can cause damage. So that same concept is going to apply to your heart and really any muscle tissue. when I have coronary injury, the ST segment is going to be elevated. So it's going to be above the isometric line. So here, let's go in here. I have in yellow, that yellow dotted line is that isometric line. See the very beginning of my P wave, very beginning of my P wave. There you go. And my J point is above there. So this is indicating coronary injury. There we go. So now let's move on to the geography of the 12 lead. We've gone over this a little bit, I believe, but I want to go over it again. So each lead is going to represent a different geographic portion of the heart. And I have those annotated here. Lead 1 is going to be the lateral aspect of the heart. 2, the inferior. 3, the inferior. AVR is not used in interpreting STEMIs in the pre-hospital setting. We can go into that another time. If you have questions about that specifically, that's not really what I want to address here. I don't want to get into the weeds of that, but please reach out. But for information purposes, AVR is generally not used. AVL is going to represent the lateral portion. AVF, inferior, V1, septal, V2, septal, V3, anterior, so on down the line, anterior, lateral, and lateral. So these leads can be grouped together to see which area of the heart is affected. So, for example, I have a 12 lead here. So let's go over each box. Okay, now again, it's a little blurry here, but this is a part of ECG interpretation and 12 lead interpretation. Sometimes these boxes are just really hard to read, and so let's get into it now. They're very small, and I oftentimes can be found just using a pencil or a pen to try to help draw that isometric line, and that gives me a point of reference. So anyway, I got my iso lines drawn, and I want to find my J point. My J point, the very end of that QRS complex, is right there, right there, right there. And that is low. It is depressed. So that what that signifies is that in the lateral portion of the heart, there is ischemia. Moving down the line, we have elevation. Elevation. Sorry, I'm having some issues with my touchscreen. Okay. AVL, depression. AVF, elevation. V2, depression. V3, depression. And V6, depression. So, what do these three things have in common? And by these three things, I mean this area, this area. I really wish I could keep my laser pointer going. This lead, and this lead. Each of those represent the inferior portion of the heart, and so this patient is having an inferior STEMI. We can hone in on the specific area of the heart geographically that we have cardiac instability, cardiac damage, ischemia, and that is the inferior portion. So again, here we can see ST elevation in 3 leads in the same region of the heart. To be a STEMI, ST elevation must be greater than or equal to 1 millimeter in 2 or more leads of the same region, or ST elevation greater than or equal to 1 millimeter in touching V leads. So what does that mean? So again, I have 3 leads here in the same geographic region that have ST elevation. In order for this to be a STEMI, I actually only need 2. But this patient is going above and beyond, they have 3. ST elevation can also count in the V leads to be a STEMI, as long as they are touching one another here. So let's go into it here. So let's do another one. All right, I have elevation in the lateral lead. nothing in lead 2, depression in lead 3, elevation in AVL, depression in AVF, depression V1, depression V2, depression V3, nothing in V4, elevation in V5, and elevation in V6. So, what does this patient have? Well, we have 2 leads here that are lateral. So this patient is having at least a lateral STEMI. And then we have 2 touching V leads here that happen to be in the same geographic region, though they would not need to be. The anterior, so what this patient is having is called an anterior lateral STEMI. Now, if this individual had elevation in V4 and V5, it would be referred to as an anterior lateral. Wait, no. What am I talking about here? Yeah, I marked this incorrectly. My bad. So let's fix that really quick. Doop. Doop. And say I thought something looked wrong. Sometimes we all make mistakes. So let's double check, make sure we're good to go here. You'd think I'd know after all this time. So we have anterior lateral lateral here. So if I had elevation in V4 and 5, what would that be? V4, V5, I would have an anterior lateral STEMI. Say I had elevation in V2 and V3. What would that be? That would be anterior septal. So really what you're doing is you're plugging and playing with the leads that you need. I would reference the geographic portion of the 12 lead often. I still do. You know, I should probably know all this by heart, and I do sometimes, but sometimes I forget. So I reference it often. You know, what is lead 1? What is lead 2? What is lead 3? So on and so forth, so that you're very familiar. And if you're not sure, just make sure you check. Let's talk about reciprocal changes. And this is when an area opposite an area with elevation has ST depression. So, for example, in this 12 lead above, you do see this. I have elevation in the anterior leads and the lateral leads. Yes, gosh. Anterior and lateral. So, what is the opposite of those areas? Well, we would say septal. Lateral and septal are going to be opposing one another, and I have ST depression specifically in those leads. You do not need reciprocal changes to call a STEMI, but they do help bolster your case for pitching it to the emergency department. Again, so let's go over what do I need to call a STEMI. I need ST elevation of 1 or more boxes, millimeters, in geographically similar areas or touching V leads. If any of that is confusing or you want more clarity on that, please reach out to me. I'm happy to discuss this and dissect it at further. I appreciate you all. Thank you for your dedication to learning more. And if there's anything more cardiology-wise that you guys want, please hit me up. For this series specifically, we're going to call it. But again, I appreciate you all. Keep up the hard work.